So first of all, I'd like to share with you the concept, what is called health emergency and disaster risk management. This is a relatively new concept, which is integration of existing concept on health emergency and disaster risk management, which includes not only the natural disaster response, but also natural disaster, man-made disaster such as a conflict, as well as the infectious disease, communicable disease outbreak, including COVID-19 pandemic too. So this is the very broad idea to include all hazards, how to address the response, recovery, preparedness for all hazards of health emergency, disaster risk management. That is a concept, what we are addressing right now. And this activity started in 2015, actually. There was a Sendai conference, what is called Sendai Conference, the third UN World Conference on Disaster Risk Reduction. This is the biggest opportunity for the whole UN members or member states to discuss the how to manage the disaster risk reduction as a direction of a whole world. Actually, this third conference was really impressive for the health sectors, because the health has been considered as not the mainstream of the disaster risk reduction until this Sendai conference, actually. Looking at the reference for the resulting document of those conferences, the first conference was held in Yokohama, 1995. Nothing about health was mentioned in the resulting document, Yokohama strategy. In second one, from 0 to 1, Hyogo conference, Hyogo framework include the 3 words about health in the document. But in the Sendai framework, the health was stated as a purpose of disaster risk reduction in the official resulting document, Sendai framework. And over 30 references about health was mentioned in the resulting document. That was a great progress for health sectors. And we now consider that the health is the core law of the disaster risk reduction in the whole context. So to do to conduct a good policy and program, we need reliable scientific evidence to refer for the policy and program. But this area, Health-EDRM, health emergency and disaster risk management, is not well documented yet. And this is a very difficult area to conduct research because after disaster, after the emergencies, everybody goes to the disaster area, emergency area to save people, but to conduct research for the improvement for future development, that is a little bit difficult to conduct actually. So this area was not well documented. That is why WHO decided to convene the global researchers to work together to systematically improve this research area, which called Health-EDRM, Health Emergency Disaster Risk Management. And this is the research network, what is called WHO Health-EDRM Research Network. That is a global research network to discuss the research gap and address the gap, and also to synthesize the knowledge for the policy and development. So this research network currently is 3 years old. It was established 2018. And now we have over 200 experts from all over the world, including Griffith University colleagues. So that is the background of the research, your project. And recently, we have published this guidance, WHO guidance on research methods for health emergency and disaster management. This is the first textbook published by WHO to explain how to plan, how to conduct, how to report, how to disseminate the research project for Health-EDRM. So that is the very big progress for this research area, how to address the research needs by conducting the reliable research methods. And following that, currently we are working on the development of the WHO Knowledge Hub. As I mentioned, the knowledge on Health-EDRM is not well documented yet, and we're not synthesized knowledge yet. So that is why currently we are working for this several key research area, including the vulnerable population management. And we already have communicated with Professor Claudia Chu, as well as Connie Gan, about how to lead the area of the vulnerable population management in disaster risk management. That is one of the key areas to improve the policy and program. So in a few months, we are going to establish the working group for this launching the Knowledge Hub website for WHO Health-EDRM. So that is the kind of invitation to you also to be involved in this global research network activity and also this Knowledge Hub development. Because some of you, the policymaker, decision makers in Indonesia, that is a key collaboration between researchers and decision makers, how to use the research result for your program, for your policy in the future. That is the next step for us to go beyond just conducting research and publishing the result by the journal papers. So if you are interested, please join, or please just send an email to me to be involved in our research network activity. And I'm very happy to be here, and thank you very much again to Makasi for inviting me into this wonderful workshop. Thank you very much.